Déanach Pat Cullen Road and Sean Garrity Kanya, thank you very much for agreeing to be here as part of our virtual winter programme. This event, Nurses in the Frontline in a Pandemic, is obviously very topical at the moment and very relevant, and we're delighted to have you here. If you want to just introduce yourself for anyone who may not know you.
Thanks, Kalina. First of all, it's a pleasure being here. What a centre to be in, and to be in the James Connolly Centre and to have the affiliation they has had with trade unionism means a lot to me, I have to say. So I'm Pat Cullen and I'm the Director of the Royal College of Nursing. I've been a nurse for 36 plus years. Don't want to say too much more about that.
Nobody believe you, Pat.
And I suppose I've had a privileged career, Kalina, and what a way to end my career, to actually be able to represent those people that have done so much for the public in the north and for every patient that they come in contact with every day.
Definitely, and what work they've done. You know, I doubt there's anybody here who at some stage in their life, from the day and hour that they're born, haven't had the privilege and the honour of having a nurse looking after them at some stage, and we're very lucky to have the services that we do. So Pat, your career has been eventful in terms of the RCN so far. So not too long ago, for the first time in 103 years in the history of the RCN, you led the nurses here in the north out on strike. Why was that?
I did, and I look back and I didn't think, my goodness, was I mad or was I just courageous, or a lot of other things that people describe me as. And just looking back at that time, Kalina, I'm in post now, just going on 18 months, and I remember at the time that I was asked by the company that was leading the recruitment, ringing me up and saying to me, encouraging me to apply for this post. And initially I was very reluctant, and there were a number of reasons for that. I did have to think about it, and not that I didn't feel that it would have been an honour and a privilege to do it, but at that point in time I looked at where nursing was, and I thought to myself, here we are with a nursing workforce in the north who has absolutely no voice. Their voice was completely dismantled, and we know that when you dismantle anyone's voice, but particularly those who are the lowest paid, when you dismantle a voice, you dismantle value. And to me, I thought seriously about what could I do about that, because what I wasn't going to do was take up a very privileged position to represent those nurses in their trade union and find myself in a place where I would tread water and they would be no better off at the end of that. And I couldn't have done that, both morally, ethically, and from a professional perspective, I couldn't have done it. So after thinking long and hard about it, I thought, well, if I am going to take on that role and have the privilege of speaking up and speaking out for the profession that I value very, very dearly, then I'm going to do it with the full weight of the nursing workforce behind me. And I'm not going to devalue their voice, and I'm certainly not going to value the care that they provide, because we all know that nursing is a 96% female workforce, and they provide care. And if we go back through our history, and if we read the works of James Connolly, we will see that women in society has been devalued, and we see that women in caring roles tend to have much more of a job in their hands trying to get their voice heard in society. So it was for all those reasons I felt, well, okay, I will do it, but I'll do it with the full weight of the nursing workforce behind me, and I'll make sure that I don't add to that devaluing of their voice and the value of caring in our communities.
It's very interesting that you say that, and it was by no means, I'm sure, an easy decision, but certainly a very courageous one to take in the times that we're in, and I've no doubt that you met with challenges along the way with the strike. How did you deal with those challenges, Pat? That was a baptism of fire into a new path in your career. How did you deal with the challenges that you met at the time of the strike when you went out?
I suppose, Clodagh, looking back, I found challenges from day one, because when it came into post, we had 3,000 vacant posts here in our services, and that was only the posts we knew about. That was the departmental figures. If I was to say that I believe those figures, probably not. I knew there were a lot more vacant posts. I also knew from my previous jobs that the voice of nursing at top tables was a challenge, and it was a challenge to get heard. And I knew that when at those top tables, of which I was part of, that the fight that we had all of the time as a predominantly female workforce to actually always have to prove our worth. That was the first thing. And that when they were looking for cost savings and looking to get money out of the system, inevitably they always went to nursing. And I knew that that was going to be an immense challenge if we were going to turn that big tankard around and change that ethos and that thinking. We also know that we've had years and years of Tory austerity in the north, and we had a health service that was depleted, not just of a workforce and a very valued workforce, but of financially depleted as well. The other thing that was a challenge for us as nurses was that we had a total absence of political leadership at assembly level, and in that absence and in that void, those positions were taken up by senior civil servants and a permanent secretary at the Department of Health, who I personally felt very strongly had little value on nursing. Like any void, when you have a void in that level of political leadership at that level, people that fill that space tend to fill it with different values and different ethoses than I would suggest would be the right ones, and consequently felt that they were in a position to make decisions that would have a negative effect on the front line and those nurses that were trying to provide care every day to our communities. So there was only one way to go about this in my mind, and that was to look to your own workforce and your own people that were in the lowest paid jobs and were trying every single day to do their very best, and to say to them, what do you want me to do for you? Because I think if you listen to the people that you're there to represent and take your mandate from them, you won't go wrong. And I remember thinking that the very first night before I took up post, I thought, I'm going to listen to the very voice that has been dampened down here by those in power, and I will take my direction from those people, and honestly believed that if I walked every step with the nurses right beside me, I wouldn't go wrong. So that was I suppose my own way of heading into the strike. And as soon as I took up post, I spent my first weeks and my first month getting out and walking every ward in every hospital and meeting as many of our community nurses and our nursing assistant workforce that I could meet with, and asking them, what do you want to see happening? What I seen was a totally demoralised workforce, a workforce that was doing their very best and couldn't do any more, and we couldn't take anything more from them. And what they were saying is something needs to change because we don't have a voice here, no one's listening, and they felt they were letting their public down and their patients down. So that led us very quickly into a decision to ballot our members then for industrial action and including strike action. You asked me what were the challenges. Of course, once that became known within the system, in a system that was very controlled by the Department of Health, immediately I did come up against significant resistance. The big worry was that resistance would have an impact on those people that were still trying to provide care. So it's one thing having been resistant towards me and what I'm bringing as a trade unionist. It's another thing if that impacts on the people that's still trying to do the work every day. And if you remember back to the time that those very formidable nurses stood on those picket lines, they did it with such aplomb and with such respect and such dignity, with the full weight of the public behind them, and that's because they knew it was the right thing to do for their patients.
Most definitely, and I remember we're on the Falls Road here, and we've the Royal just down the road, and I remember seeing them out on strike, and there's something very powerful about it, and the very fact that it was the first time that action had been taken, and as I say, and as you mentioned, was not taken lightly, shows the strength and the unity of voice that the trade union represents for those nurses. Obviously not an easy decision to make, and lots of challenges behind it in terms of pay and the overall crisis within the health system. But in terms of what was achieved from the strike, Pat, how do you feel those outcomes worked out for the nurses?
Well, the nurses took strike for two reasons, and their principal reason, which probably gets a little bit diluted by those in power because they wish to dilute it, and that is they took strike action to have reinstated the vacant nursing posts. That was their reason, not for pay in the first instance, but they knew that if we addressed the pay issue, we would address the vacancy rate. So the nurses were first of all asking for an additional 300 student nurse places each year for the next 3 years in our universities, so that we could start to reinstate those people or nurses back into those vacant posts. That was their main reason. The other thing that they wanted for and asked for in their dispute was that we would have safe nurse staffing legislation put in place in the north. Now, why did nurses feel that was so important? It's important because it holds those people to account that should be held to account, those people in leadership positions, and not hold those nurses at the front line, those nurses that are getting paid £23,000 a year and responsible for the vacant posts, because that's where the responsibility had been shifted to the nurses to make sure that everything was kept right, that their patients would be looked after, even though they were working with very depleted workforce. That responsibility should never have been put on those frontline nurses. It should have been with those people in power that ought to be doing the right thing for the public, but also for the workforce. So that was the first two reasons why they went. And the third thing was to reinstate their pay parity. And what they meant by pay parity was to be paid no different, no more, but certainly no less than a nurse working in Manchester, Liverpool, Cardiff or Bristol. And what an indictment on our society that we thought it was okay for nurses in the north to be paid 13% less than a nurse doing exactly the same job in any of those other areas. So, that was just wrong. That was absolutely wrong. And we know that it was at the time of Jim Wells being health minister that he broke from pay parity here. And that was a completely slippery slope, because nurses were sent a very strong message at that point that they were valued less, that the job that they did meant less, and that they could go elsewhere and be paid more and have better staffing levels and be able to provide the care for which they were trained and expert in doing. So that was the principal reasons why those nurses took to those picket lines, and they didn't do it easily. They gave it very careful consideration, but they knew they were left with nowhere else to go, and I think that says an awful lot about those people that were in leadership positions within our society at that time, civil servants and others, to actually have pushed those lowest paid workers onto picket lines to speak up for their patients.
Yeah. And when 13%, that's a huge percentage, a huge gap in the pay parity, and as you say, it's never just one factor, rarely just one factor. Those combination of factors where there's an overall workplace gap, where the pay parity isn't the same, all of those impact on morale, and when I think of the work that continued, right up to the point where action was, it's incredible that it went on so long as it did, and it just shows the strength of the nurses and their commitment to their care and to their role, that they held out, I suppose, as long as they could before they felt that they had to take the action that they did. And as I say, it was in some ways heartwarming to see the support that was there for them when you did take the action. I'm sure there are plenty of stories you could tell about the picket lines.
You could write books about it, Clina, but when you think about it, 7 years without a pay rise, and yet those nurses kept going. and going and going, and seeing the nurses in other countries, their pay increasing year on year, and yet our nurses in the north being treated almost as second-class citizens, or some of them would say to me, people that were left on the back of the bus. And we all know what that term means, and the significance of that. And that was just so wrong to do it to the people that if we've seen their weight in gold now during this pandemic. It was just wrong.
Definitely.
You talked about the people and the public support, and inevitably that was the one thing that kept me awake at night leading up to the strike, and it certainly weighed heavily on every single nurse, and that is, are we going to be letting our public down? How will the public suffer as a consequence? And we all came to the conclusion that the public were already suffering here in the north, because we had the highest waiting lists in all of Europe at that point in time. We were literally within a health service that was barely able to function, and we had a permanent secretary who was then the leader, who actually came out, brave and all as he was at the time, to say that actually our health service was staring over the side of the precipice, and yet those were the people in charge were actually coming out and admitting that, and it was the nurses that were actually trying to get the health service to clamber back up the other side. So they had no choice, and the public knew that, and I suppose it left me absolutely, coming away from that strike, I knew never underestimate your public, and never underestimate the people here in the north, because they do know what's going on. They do know who speaks up for them, and they do know that the nurses will always do the right thing. The support on the picket lines from our people was just immense, and if you think we were taking strike action in December and January, and it was bitterly cold. And I'll tell you one example of being on. We were normally out on the picket lines from about 6 o'clock in the morning, getting prepared, and it was one morning at the Royal, and I think it was our first morning, and there was I was standing talking to some patients who were coming and going, and members of the public coming and going, and this elderly lady who was quite immobile came out, and she was using a walking frame to get around, and some of the nurses had went over to her because they thought it was very slippery, it was frosty, and she was standing holding one of the nurses' hands. And anyway, she had said to one of the nurses about being very cold. It was a very cold morning, and she left the picket line, and she lived up just off the Falls Road, and about an hour and a half later she arrived back in a taxi, and she had went to one of the local shops and bought 10 hot water bottles and filled them up and put them into her wee grocery trolley and brought them back down to the picket line to those nurses. And I remember coming away thinking that day, this is definitely the right thing to do, because people like her deserve a better health service, and our nurses deserve to work in a better health service.
It's complete validation there, and from somebody who obviously saw the value in the work that was being done, more so than as you mentioned, perhaps many of those people who were in power and who had decision making powers, but also on a really basic human level. To see that support is so lovely. And you mentioned there, Pat, that takes us on, I suppose, in terms of timelines in December and January, into then what was to become another crisis that we are unfortunately still in, although hopefully seeing some sort of a light at the end of the tunnel. Of course, then COVID-19 hit in March of last year, and I suppose all of our lives changed in a way that we could never have foreseen for much longer than we ever foresaw. And again, we saw the value and the work that our healthcare system and particularly our nurses do. Tell me about that, and when the pandemic hit, how that affected both the nursing workforce and then your own role and work as a trade unionist.
Okay. Well, as you rightly said, the nurses had barely recovered from the industrial action and the strike when they were thrust into the pandemic. There's a couple of maybe positive things out of that, because at that stage, that nurses, I felt for the first time, Cleena, that nurses had got their shoulders back up again. And the principal reason for that was that they had got the assembly reinstated. And we now had political leadership, formal political leadership in place. And we had political leaders that were willing to talk to us and willing to hear the voice of nursing. And that meant so much to nurses. And consequently, we were able to suspend our industrial action. And I think it's really important for me to say it's not ended, it is suspended. And the reason for suspending the action was that the areas of dispute that we had asked for were signed formally off by the executive, and that they would meet those areas that the nurses. So pay parity was reinstated. There is a commitment to put in place safe nurse staffing legislation. There was a commitment to the 300 additional student nurse places each year for the next 3 years, and we're seeing those nurses now, those students now coming through our system, which is brilliant. There are a number of other areas that were within our areas of dispute that we have yet to achieve, including safe nurse staffing. And until we achieve those, the nurses are clearly saying we will not end our industrial action. It will remain in suspension, but please not let us push them back to that they have to do that again. That would be really, really important. So we had just got our shoulders up and nurses were feeling, look, perhaps maybe we're going to be listened to now for the first time in a long time, when the next thing, the pandemic struck. Talking to my colleagues, they would say that actually going through the challenge of industrial action and a strike and the camaraderie that brought about, and the validation, as you talked about earlier, which was a really good word, the validation from the public about nursing and the value of nursing and the value of caring, actually they would say left them in a position where they were facing into that pandemic in a better place and feeling better and feeling that they were in a much stronger position to be able to do what they've done and done with such wonderful aplomb throughout this pandemic. But it has taken its toll on them, because they were still facing into it with 3,000 nursing vacancies. You don't fill those overnight. No. And then on top of that, the vacancy rate as a result of nurses having contracted COVID-19 and been off on isolating as well. So it's been a real challenge for them. They've taken on that challenge with gusto. There's not a single nurse that has been found wanting during this pandemic when it comes to their patients. They have had to fight at the beginning, if you remember back to wave 1 of the pandemic, and the challenges we had with getting PPE for our nurses. That was really, really, really difficult, because we're facing into the unknown. We were very unaware of what levels of PPE would actually protect our nurses at the time. But it just seemed like another battle that was on our hands every single day, trying to plead and force with people to make sure that they had the right level of PPE for caring for their patients, and that was really, really difficult for them. The second thing that was difficult was that nurses were being redeployed from areas that they were familiar in and moved very quickly, and sometimes without much attention to their skills and expertise that was needed within particular areas. So nurses that would not have been familiar with working in intensive care areas were moved overnight into intensive care, and that was a big challenge for them. And also being moved from hospital to hospital. So we had challenges with nurses who were working perhaps in Enniskillen, Omagh, and being moved to the New Nightingale in Belfast. And whilst nurses understood that and understood the need for it, what we were saying is that if we hadn't have got ourselves into the places where we were with the vacancy rate and having decimated our health service so much, we'd have been able to meet this pandemic with a bit more rigour than what we did at that time. And again, it was left up to the front line to hold it all together, and that was the belief of the nurses. And then you think of, we are a 96% female workforce. We then had, on top of that, whilst those women were out every single day doing the jobs that they were doing in intensive care units and COVID wards, the Nightingale Hospital, they were then coming home to do homeschooling. And they were also holding families together, because it is a true saying, you know, men's work is from sunset to sundown, isn't that right? Or sunset, from sun up, sundown, women's work's never done. So they were holding all of that together and doing all of that work as well. And then if you think of the nurse Noma that was redeployed into Belfast, she then had a 3-hour drive back to home in the evenings to make that all happen for her. We also had nurses who faced at that stage a little bit of challenge with local communities, who felt that they were carriers of COVID. So there was a little bit of the various communities feeling challenged by nurses perhaps coming into shops and being available in their local communities, and they were challenged with that and found that people were scared. And that's what happens when people do get scared and get afraid of something and afraid of the unknown, then they act like that. So that was difficult for nurses as well. They found it difficult to get shopping done.
I wouldn't even have thought of that, but you can, of course, as you say, when people are afraid, rationality sometimes doesn't always come into it, and those challenges are so hard. Like, it's difficult enough in a pandemic trying to get your shopping and trying to do all of those things as safely as possible. With those added challenges, it's hard to imagine.
Yeah, and then coming on, you know, we start duty at 7:15 in the morning, and if you had a 2-hour drive or a 3-hour drive from Enniskillen to get here, you can work that out for yourself. And at that stage, then with the shops being closed, they found it difficult to get groceries. And that was just small things, but they were really, really important things as well. But that's where we did see the value of our executive really coming into force, because some of the arrangements then that were put in place for healthcare workers being able to access local shops in the morning before they got to work was really, really important. The other thing that nurses were challenged to do at the time, but they again stepped up and did it. I am in absolute awe of nurses. They would have been in contact with myself about they found it difficult to get scrubs. They were told that they wouldn't have access to scrubs, and that they would inevitably have to wear their normal uniform, and they would then have to wash those uniforms at home. And they were scared that they were going to be bringing COVID-19 back to their own families. So a lot of them had, and they are quite innovative in their thinking, and I've seen it with my own eyes, where they put buckets of water and sterilizer outside in their porches. So when they came home at night or came off night duty, they stripped up their front doors and washed down before they got into their house. So I thought the least we could have done was give them access to scrubs so that they wouldn't have to wash their uniforms along with their own family laundry. But that was a bit of a battle again. We found that our local politicians were very good about stepping in and making some of those things happen for them. For example, if you think of Pat Cullen was one who was very instrumental in getting shower facilities opened up at St Malachy School for our nurses, and just those small things meant the world to those nurses who were so scared about coming home and infecting their own family, and not just about infecting their family, but then having to go off sick and leaving already their colleagues depleted, further depleted from a workforce. So all of those small things meant the world to them.
It's incredible, and as I say, you know, as a community, we of course stood behind the nurses and the medical profession as a whole, you know, from nurses to consultants to porters to cleaners to people cleaning the scrubs in the hospitals, bringing you your food, doing all of those sorts of things. You forget about, that's not true, it's very easy to forget about the personal impacts on people. The physical exhaustion, nursing, as I understand it from knowing some nurses myself, is a physically demanding job. As it is, it's, you know, you're on your feet a lot of the time. The shift work is difficult. It's not your standard 9 to 5, as some people would know. But you forget about then those other things, such as the travel, the impact on families, the impact on mental health, the impact on relationship, the impact on morale. in general, at a time when people are already hit very badly. And it's nice to know that there was support there, and that you as a trade union, the RCN as a trade union, were able to help, I suppose, bridge some of those gaps.
Yeah.
I'm sure you could tell some I suppose awful and good stories of those, and it's nice to hear though that even things like local schools and stuff coming to the fore, and working in conjunction with local politicians and local representatives. It's great to see that had some positive impact on the nursing
That was
force.
so important, Clina, and actually local community activists and local politicians were worth their weight in gold when it came to things like that. Because we as a trade union were able to have a direct line almost in and say, look, we really need you to help out. I remember Michelle O'Neill as Deputy First Minister coming to meet with a group of nurses in the college, just as we were about to move into the first wave. And those nurses that day brought along with them some of the PPE that they were being forced to wear at that particular time, and sharing it with her. And it was in a day or two just after that she had worked with O'Neill's to bring them in to make scrubs. And again, just that may sound like a small issue, but it was worth £1 million for each nurse. It was so important.
It's a huge. It is in some ways a small issue, but it's a huge issue. And as you mentioned earlier, you know, the likes of the strike and the factors behind that were played out in the pandemic. You know, things like basic staffing levels, things like PPE seem like such a basic necessity to me. I'm thinking, how could you possibly go in and do your job? You know, anyone going in to do their job needs their essential tools, and to me a PPE for a nurse is an essential tool in normal times. I use the term normally, never mind in COVID times. And I suppose you just see that depletion of the workforce and the lack of resources of the workforce really hitting hard. But I suppose seeing some resilience there is wonderful to see it coming through in times of need.
Absolutely.
As we go forward then, and we are hopefully seeing some light at the end of the tunnel, Pat, and you're now in your role almost 18 months, as you mentioned. As we move forward into 2021 and what will hopefully be a slightly brighter year for us all, but for our nursing staff as well, what do you see in terms of trade unionism, in terms of nurses, as we go forward? What do you see as the future?
Well, I think that anyone in a leadership position moving forward needs to really, really stand back and recognise the value of nurses. And all healthcare workers, but of course I'm here speaking about nurses and I am a nurse. And they must never underestimate nursing again, and the importance that it has for every single patient in the north and every person in the north. And if we devalue nursing, we devalue people, every single patient. And that's so wrong of us in leadership positions to do that. That's just not right. That's the first thing. The second thing I would say is that nurses, we are about to embark on another round of pay, and nurses need to be paid decently. And giving them a COVID handshake that they've just had is not the right thing to do. It's most certainly not. It was welcome, but at the end of the day, we should not see that as a substitute for paying them decently and with a good pay rise that they deserve. And when we think that nurses here have fought for pay parity, and that's the lowest paid workers in the health service when you think about it, what we needn't do this time round is put them through the same again, because nurses' pay at this point in time is still 13.5% behind in real terms, and it has dropped over this last 10 years. So if we do not do something seriously this time round in 2021 about nurses' pay, and I don't mean a 1% or a 2% pay rise, because that ain't going to do it. They need to be decently awarded this time round. If not, I do fear for the profession. because I am hearing day and daily from our nurses that they are coming out the other side of this pandemic totally exhausted. They have dealt now with a year of despair, desperation and suffering, not only just on the patient's behalf, but also from the nursing perspective. That has been really, really difficult for them. We are seeing the first signs of nurses showing symptoms of PTSD and serious moral distress. So if we don't do something to acknowledge what nurses have done, and the one way that we can do that is through a decent pay award, then I would be very fearful that we will definitely lose nurses out of the system. There's no doubt about that, and they will go elsewhere. I'm already working with a number of nurses who are looking for career changes, and I'm saying to them to hold off. They don't want to do it, but they cannot any longer continue to work in the system that we've got, that perhaps maybe gets them back to where they were on picket lines again.
So it's a matter of support, I suppose. My interpretation there is of practical support in terms of pay parity and a proper, up-to-date, decent wage that allows them to live and to work at the same level as a nurse anywhere else. Especially given the work that they do normally, but that they've done in COVID, but also I suppose on a practical level in terms of their own health and their mental health and their mental well-being, because there's no doubt that we as a society will have suffered as a result of this pandemic, but those people on the front line going forward, I'm sure we'll be seeing the fallout of the last now almost 12 months for a long time to come.
They will, absolutely. And when you think of nurses that we have got in our system have worked now on an average of 14 hours a day every single solitary day to keep the system working throughout this pandemic. They do need a break, they need a rest, but more importantly, they need to be acknowledged through a decent pay rise, that we do value them and that we value caring and we value a predominantly female workforce. And I really, really, really do mean that, Lena, that we must not do this to, I keep thinking to myself, would the same things happen if we were a predominantly male workforce? And, you know, history does repeat itself at times, and we can see that women and predominantly female professions do have to work very, very hard to have their voice heard, and I don't think we should do that to the people that carried us through this pandemic.
100%, and it's huge, you know, to hear you say that, Pat. You know, as someone who has been on the front line, who has been standing by those people, and I suppose it shows the value. And as you mentioned, you know, we're here in RSC Connolly, we're here in the James Connolly Visitor Centre, and Connolly was a trade union pioneer at the beginning of the last century, at a time when it wasn't the done thing, and trade unions continue that battle now in the 21st century as we go on into the 2020s. It's lovely to see that power is still there, that strength of unity, and that you can see the strength of the trade union now. It's sad to see that they still have an awful long way to go in terms of those challenges that they face and that you face day and daily, but it's great to see the work that the RCN and that other trade unions are doing in this time, and more power to you. On behalf of myself and of the Connolly Centre, and I'm sure of the wider community, particularly here in West Belfast and further afield, thank you very much for the work that you've been doing. Thank you for coming in today, Gurmila Moygat, and we'll hopefully get to see you again sometime in the future.
It's a pleasure. Thank you very much for having me.